So, Dr. Henry, I understand that you're going straight into a briefing not too long after our discussion here.
Yeah, it's the usual day. Kind of a busy day, and I have another meeting before that. So yeah, things are busy these days. It starts early and it finishes late.
And probably for every few minutes that you're on camera, there's quite a lot of preparation behind that.
That's absolutely right, and it really is about, we talk of the numbers, but the numbers of people that are involved in making sure that we connect with all of the hospitals, all of the ICUs. Unfortunately, we're on very different IT systems around the province, so it was actually quite a challenge to get that information into one place, and we still, each of the health authorities reports in on their new cases, and we consolidate that with lab, and so it does take several hours for even just the basic numbers to get reported. You would think with technology that we get. Oh, I'm sorry.
I'm going to jump in for a quick second and just welcome people as you're coming in. Don't worry, you are not late. We're just chatting a little bit as we're getting started. You can see here we have Minister Joyce Murray with us, as well as Dr. Bonnie Henry. We'll begin the program formally shortly, but thank you for joining us a few moments early.
I was just thinking back, Dr. Henry, to early 2000s when we had 53 health authorities in the province of British Columbia, each with their own sets of technologies, protocols, data collection, and so on. And so I think when I see the struggles in Ontario, I wonder how much of them have to do with the multiple health authorities and trying to roll up the information from all those sources. What's your thoughts on that?
Yeah, absolutely. One of the things we did, and I'll talk a little bit about this a bit later on, but it was to pull together a provincial approach. And the fact that we have 6 health authorities plus First Nations Health Authority, and we were able to, all get together very quickly, really helped us here, even with our IT differences. But yeah, it's a huge challenge in a place like Ontario where it's just levels of complexity. Every hospital is its own entity in Ontario, and they're not linked in the same way that we are.
Mm-hmm. Well, I have before we start and we're really into our program, I have a burning question.
Uh-oh.
Are you wearing your pink Fluvog shoes today?
Oh no, I got blue and cream-colored Fluvog shoes on today. So the new shoes, the Dr. Henrys, are not yet here yet, though I understand they're being made, and they should be available in the next couple of weeks.
That does remind me, I was going to wear Fluvogs today in honor of this conversation, and I forgot to do that. I wonder how many of us on the call have done so.
Well,
I'm really grateful. Fluvogs make great shoes, but he's so much a part of the community as well in Vancouver and across BC, and that we've raised over $100,000 for the food banks, the BC food banks, at a time when they absolutely did it. So that makes me feel really good.
Well, what a creative gesture on John's part. And when I see the shoes on the internet, I think of Dorothy and the Wizard of Oz, and I'm sure that was part of his inspiration, because the way she was leading the charge on that yellow brick road.
Yeah.
A bit of a parallel here, Dr. Henry.
Yeah, somebody sent me a painting that they did as well that has me holding a shoe up to the virus, so a pink shoe. I thought that was great.
For the purposes of today, would you like me to refer to you as Dr. Henry?
You can introduce me as, and then Bonnie is fine, thanks.
Okay, and I'm Joyce. Yeah.
And so we've got about 240 people that have joined us, and the number is steadily clicking up. So maybe we'll begin formally in about 2 minutes, giving people a chance to join us.
A few more people than fit into the coffee shop last time we talked.
Did you have a brunch moment together previously?
Yeah, we did one on the overdose crises. That was
Yeah.
2 years ago now, I think.
Well, it's not lost on me, Dr. Henry, that at that MP Breakfast Connections, you were talking about the legalization for therapeutic use and carefully monitored therapeutic use of the drugs that people were otherwise potentially dying from. And I note that in this crisis, you had a chance to apply some of that thinking.
Yes.
I'm just going to
still
1 second and just remind and let people know good morning and welcome. And I just want to let you know that we're just having a bit of an informal chat here while we're waiting for people to get started. So don't worry if you're arriving just now and feeling like, oh, did you miss something? You haven't. The program will begin formally in just a minute or two.
And it's not lost on me. I was talking this morning about, unfortunately, in March and April, our overdose deaths are over 100 people again who died. And, this crisis on top of that crisis has made it very, very challenging for many people. And we're still holding our hands and trying to help go through that.
Yeah, I can only imagine the challenges. Yeah. So Susanna, may I ask you, is this, what's the largest size of virtual meeting that you've facilitated so far?
So like we've all been figuring things out. Let's see. So last week I gave a webinar presentation to about 600 people, but in terms of interactive, about 250, where people are kind of going in and out of breakout sessions. Mm-hmm. It's just amazing to see over the last 2 or 3 months, people's comfort with the technology, willingness to jump in and try new things. Mm-hmm. And I really feel like this has been a great opportunity to increase our use of tools that enable people that are spread across geography, that are unable to travel because of physical challenges. It's really given us a chance to have forced innovation. And, not all of it's perfect, but I think there's an appetite for learning and trying new things. So it's nice to see.
We did a webinar with continuing professional development at UBC last week, myself and Dr. Mel Cradden from the BCCDC and Dr. Dave Patrick, and there was close to 5,000 people who tuned in.
Amazing. Could you have imagined that, 3 months ago? No. Well,
and I was sitting at my kitchen table.
Right? All of us with cats walking across the desk.
I know, I'm worried about the pets now that we're heading back out again. They finally got used to having their humans home all the time.
Totally. Minister Murray, it is 11:03 and we have about 330 people here. Let's get started.
Great. Well, good morning, everyone, and welcome. And I also want to begin by welcoming Gail Sparrow from the Musqueam community to start us off with a traditional blessing.
Do I touch something here?
Yeah, and then you may want to bring on your video as well, Gail.
Okay, Rosin. Okay, I'm just learning as I go along here, so.
We all are. Oh.
We all are.
Start my video.
Okay.
We here? Well, it's a ladies group. I would say to each and every one of you, Ichuail, my CMs, welcome to the unceded territory of the Musqueam First Nations, the territory which Joyce Murray is hosting this event. The Musqueam First Nations, I was acknowledging also yourself, Dr. Bonnie Henry, Joyce Murray, for this event, because we know you've been given an Indian name. It means, I will not pronounce it in Indian, I know it means one who is calm. And that's also the same character that Joyce Murray has. She's one who is calm also. So it's appropriate that both of you are here together. We want you to know that the great works of the Musqueam people has paved the way. We're a nation that's been first in many ways. The first female chief was elected from Musqueam. The first band manager came from Musqueam. the first ever great land settlement, Shaughnessy, was Musqueam. We were the first ones ever to have in our community nurses attending our community during the time of the 1960s, because we knew our health was our wealth and we were provided internally that. So today, everyone, this great opportunity we have to be connected with Dr. Bonnie Henry through Joyce Murray, we need to go forward again to provide the great knowledge, experience, and wealth we need going through this pandemic. More so to acknowledge that the First Nations are still last when it deals with knowing what we need in services and support still today, even in Musqueam and other nations throughout Canada. So please remember that and don't forget us. So we say to you all today for being here, a big haichka from our heart to your heart for this event today for the Musqueam First Nations. Haichka, my CMs.
Thank you, Gail, for your blessing and context. And I also want to acknowledge that I'm joining everyone from my home on the unceded territory of the Musqueam First Nations. And as we struggle with the COVID-19 challenges, let's not forget the important work of recognizing and healing racial inequalities and discrimination. They're the incredible impacts, so powerful in our neighboring country to the south. It really strikes us, but disturbingly, incidents of racism are also on the rise in Canada. So, to this morning's event. Certainly not something we could ever have imagined back in February when I hosted an overflowing MP breakfast at Aphrodite's, which will be opening soon, by the way, for fans. But our breakfast had 100 guests. Today we're gathered with 500. So thank you for joining us and finding this new way to connect with so many for such an important conversation is certainly one silver lining of this pandemic. I want to acknowledge that the many difficulties that people are facing during this time, including those who have contracted the coronavirus infection or lost someone to it, or passed away of an overdose at this time of difficulty. And my thanks goes to the enormous heroism of frontline workers right across the country and to everyone doing their part, volunteering, helping, and following protocols to keep our communities safe. So the incredible speed and magnitude of societal change caused by this pandemic and how we've all adapted is historic. Our government acted very quickly to help Canadians pay their bills and help employers protect jobs and shore up organizations serving the most vulnerable. And I'm going to just give you a little bit of my backstory. We have all of us have been forced to learn new ways to get help, as Susanna was just mentioning, to keep in touch with family and friends, to stay informed, work, teach, collaborate, just as we're doing right now, using digital technology. So while media coverage is rightly focused on the pandemic's victims and its heroes, the challenges and the responses, one story that really has yet to be told is the intense work behind the scenes to enable some of our federal government's responses, and that's the digital story. So as I'm sure you can imagine, I'm the Minister of Digital Government, and so it's been a very busy time. About 11 weeks ago, the Government of Canada asked literally hundreds of thousands of public servants to work from home. Part of my mandate is to provide federal public servants with the information and communication technology, the connectivity, and the tools they need to serve Canadians. So it was quite a challenge to so quickly offer tens of millions of Canadians information, services, new benefits, while ensuring openness, accessibility, data privacy, and cybersecurity all at the same time. This involved not only supporting and improving the ongoing operation of government's sometimes aging IT infrastructure and systems, but ramping it up virtually overnight and quickly developing new digital tools and solutions too. At the same time, we take Canada's great diversity into account and make sure that programs and services can be offered by and accessed by everyone, including Canadians with disabilities. So really, I'm saying this to acknowledge the incredible hard work of the many public servants who worked almost round the clock at the beginning of this crisis to make these things happen on the digital level. Canada went from 40,000 federal public servants working remotely in February and quadrupled that within 1 week. And now almost 280,000 can serve Canadians securely working from their homes. In some departments, call center equipment and capacity also was quadrupled. We needed that. And imagine nearly 1 million Canadians were able to register successfully for the CERB on its very first day. So a couple of new digital tools I thought you might want to check out. One is a secure notification service with Health Canada, and it's called Get Updates on COVID-19. And that will provide you with regular, accurate, and secure information that you can trust. And my team also led work on an app that helps to easily identify all of the various supports that you might be eligible for. And you can find that one by Googling Find Financial Help During COVID-19. So even Parliament is now a digital experiment, and I gladly attend sessions 4 times each week via Zoom rather than via Air Canada. Collectively, the Herculean digital responses to COVID-19 in Canada and in such a short period of time has been a game changer. So we do have a real opportunity here, and it's my goal and adventure as Minister of Digital Government to help transform our government's crisis-driven digital response into a permanent shift in the way we operate. More innovation, more collaboration across departments, more focused on serving you better, more simply and quickly. So now I would like to introduce our moderator for today's MP Brunch Connections, Susanna Haas Lyons. Susanna is a public engagement specialist with over 15 years international leadership experience in the field. And thank you for your help today, Susanna. And I also want to welcome today's special guest who Susanna will introduce formally. But she's someone British Columbians have grown to know and trust, whose leadership can be credited for BC's comparatively low infection rate in our country, a calm and reassuring but pragmatic voice speaking science from the heart. As BC's health officer, she's been working 7 days a week to keep British Columbians safe and up to date. This is day 132, I believe, since her first media statement back in March. And she certainly does deserve those lovely pink flu vogs that were created in her honor to raise funds. So Dr. Bonnie Henry, thank you, and over to you, Susanna.
Thank you so much, Minister Murray, and welcome to everyone here. Just a couple pieces around the technology if this is the first time you're using a Zoom webinar. So it's a little bit different than the meeting technology if you're familiar with that. You'll only see the speakers, but we do invite you to participate and give us your questions through the Q&A tool, which for many of you, you'll find a bar somewhere on the screen that has your mute and stop video, chat, and then there should be a tool that says Q&A. And many of you have actually found it and started to submit questions. So if you have questions for Dr. Henry or Minister Murray, please use that tool. There's a chat tool, so if you have questions about how to use Zoom, you may submit through there. Finally, if you are participating through the phone and you would like to submit a question, you may press *9. And when we have heard Dr. Henry's presentation, we will come to you in a variety of ways and ask and get some questions asked at that time. I do want to remind you that this webinar is being recorded, so anything that you share will be recorded and shared publicly, so please don't share personal information about yourself or other people. So thank you all for participating, and actually we'd love to just get a little bit of a sense of who is participating. And oh, I'm sorry, if you don't see options to see mute and stop your video, I was using my old reference from the other platform. Somewhere on your screen you should be able to see a chat and a Q&A function. So they look like a little bubble, and hopefully you'll be able to find it. In a moment, I'm going to find out a little bit more about who's here. But before we get started, I'd like to please ask Gail Sparrow from the Musqueam Nation to please return, as I believe we have a gift to be presented. Oh. Gail, we're on mute. So just before you jump right in.
I think you're still on mute, Gail.
I think she's trying to figure it out. Oh, there you go. You got it.
Well, I think people would like to have me on mute permanently.
I've had that told me too.
Well, one who is calm among us, Dr. Bonnie Henry, has been acknowledged also by the Musqueam First Nations. And we know that you've taken on a great undertaking of your position of keeping British Columbia, I think one of the great leaders we've had to keep us safe through the pandemic, and following all of the great advice about staying at home and socializing, safe socializing distance with one another, and being aware of the importance of keeping our personal, protection. And it's working. And I know that work is 24 hours a day, 7 days a week. And we know now should never judge a woman that walks a mile in their flogged shoes. We've made those popular also. And we know who you are. We know the shoes you wear. We also know the big job that you've undertaken. And you remained calm. And calm is great through this whole pandemic since March the 16th when the announcement came. We, in our tribe, we have master weavers, and they're women. And last year, my sisters, Deborah Sparrow, Wendy Grant John, and Robin Sparrow designed and developed a blanket for the Women's World Conference titled We Deliver. And one of the themes in the blanket was that if I can present this to you and see in this little tiny screen, excuse me. It's titled, We Stand Where We Live. And that's the theme. And we want to present to you this blanket because you're standing in your strength and your calmness, throughout this whole ordeal. We want you to know that when you receive this blanket, that's a commercial replica of an actual handmade design. And every woman received this when they came to Canada last year. There was thousands of women. And we want to present this to you to wrap yourself when you're sitting there calmly in this great work, and feel the great strength, support, and also the power of standing in your strength from the Musqueam First Nations with that name of Woman of Calmness. We will hand this over to Joyce Murray's office, and they will directly see that you receive this in your office through this great mailing service we have. So from the Musqueam First Nations, a woman who is calm, we present to you our blanket, a commercial version of a power blanket to wrap yourself in this as you go through this great work. So we say to you, Haichka from Musqueam First Nations, this great blanket. Thank you very much.
Oh, very touched. Thank you so much.
That's beautiful. Thank you. And so wonderful too to be sitting in a group of women where this women's blanket is shared. So thank you for doing that, Gail. I'm curious a little bit about who's here and how COVID has been impacting people. Maybe we'll just do 2 quick polls to get a sense of that, and then turn it over to Dr. Henry to share some of her words. So up on the screen, just a simple one just to kind of get us started. You'll see in a moment the questions. Okay, so Minister Murray normally brings us together in person. If we were having brunch together right now, what would you have ordered? So hopefully you'll be able to select an option there. Is it oatmeal, omelet, bacon, eggs, and hash browns, avocado toast, tofu scramble, just coffee, tea, or juice, thanks? What would you imagine having in front of you? And of course, it's just a light poll, but it's a nice way to kind of, if we were sitting at a table, we get to look to each other and say, have you been here before? And what do you like to have for brunch? So it looks like, wow, many of us are voting. And I'm going to close the vote in just about 10 seconds so that we can see the results. And then I'll ask you a little bit more of a serious question. And so if you don't get a chance to vote and answer, no problem. And I'm going to close it in 5, 3, 2, 1. Let's see what we would be asking from our wait staff. Looks like most of us would be ordering avocado toast, followed closely behind by omelet, bacon, eggs, and hash browns. So hopefully we can manage our appetites for just a little bit, and we will come back and then we'll have lunch in a bit. But a more serious question now. I'm actually, I think we're all curious to know about, in what ways have you been most impacted by the COVID-19 pandemic and response? And choose 1 to 3 of those that apply to you. Has it been your physical and or mental health? Has it been your family life, your work, your finances, your business, your outlook to the future, and maybe your and your connection to your community? So you can connect, you can choose 1, 2, or 3 options. And it's interesting. I mean, I realize now that when we're talking about how have you been most impacted, there's a variety of ways of interpreting that, right? Because we've been impacted in profoundly challenging ways in many circumstances. But also, as we look to our communities around us, we have stood up together and supported each other in profoundly helpful and community-oriented ways, whether it's looking after the seniors on our block or going out at 7 o'clock and clanging pans. So it looks like most of us have voted. I'm just about to end the poll here. Just one more trickling in. And I think that's an important story to tell too, right? We have to tell about the impacts of the challenges, but as a community, BC has really stood up for one another. All right, I'm going to end the poll. We can see here what how folks have responded. So almost 2/3 of us have been impacted in terms of our connection to community, which makes sense. And just below that, our family life, right? Not being able to hug grandchildren or see aunts and uncles, visit parents. And then below that, we have our outlook to the future, wondering what it's going to look like. And then our physical and mental health as well. And then many for us, our work, our finances, and our business. So a little bit about who we are and how we're showing up to the call here. Dr. Henry, I'm going to pass it over to you. I know that people are very eager to hear from you. We've already got lots of questions coming in. Feel free to keep sharing them, folks. If you have a question, please do submit it using the Q&A tool. That just helps us manage it a little bit better rather than the chat. So hopefully you can see the difference. One says Q&A, there's 2 bubbles. Use those for your questions, please. Over to you, Dr. Henry.
Great, and thank you. And thank you very much for having this opportunity to speak today. I will say that I am speaking to you all from the traditional and unceded territories of the Lekwungen speaking people, particularly the Esquimalt Assanges First Nation, and I'm very grateful to be in this beautiful land today. So what I've been asked to talk a little bit about is my backstory about, how this has evolved and what we've been thinking about over the last 152 days that I've worked every single day. What were some of the things that were going through our minds as we progress through this? And really the story for me probably starts several decades ago. We're all a product of the things that we experience in our lives. And for me, part of that was working in places like Africa on Ebola outbreaks, working in Pakistan, Afghanistan on polio, being part of the extraordinary events around 9/11 in the city of Toronto, the anthrax, and then, of course, the SARS outbreak in Toronto in 2003, where I was a medical officer of health in the city. And that was really a profound change for me and for many of us who went through that outbreak. It was recognition that a virus that started somewhere else in the world spread very quickly, that it was something new, And we didn't even have a lab test at the beginning. We didn't know it was a virus. By the time people were being sick, made sick from it in Toronto, we didn't have treatment, we didn't have a vaccine. So we had to go back to the basics of public health work, which is keeping sick people away from well people and supporting them. And it was hugely traumatic. It was traumatic on our hospitals, on our communities. And that shaped a lot of my thinking as I moved through the rest of my life, and spent a lot of time thinking about how do we best support each other in a time of crises like that, and knowing that these crises were going to continue to come. And one of the things that became really important to me was understanding that we needed to look after the mental health of our healthcare workers, and we needed to ensure that they knew we were taking, that we all collectively were taking the measures we needed to provide protection, that we were doing things in a way that was open and transparent, and the ethical underpinnings of our approach were being transparent. So things like making sure we treated everybody equally, making sure that we, the concept reciprocity. So if some people were overly burdened by the virus, the things that we needed to do to stop transmission, that we gave them the means to do that and supported people in doing that. So those were some of the thinkings that I had as I took on other jobs in life and moved out here to BC. And then we had our pandemic in 2009, the influenza pandemic, which did strain our resources in a big way. We had other more positive plant emergencies, if I like to call them, the 2010 Olympic and Paralympic Games, which were a huge positive celebration, but also a lot of work from a public health perspective to ensure we had our systems in place to protect people. And after those, we had outbreaks of measles and other things. So, as we were coming into the end of 2019, there were these rumors coming out of China that there was a disease that was causing pneumonias, but it was just a small number of people, and it was contained in this one city. And I remember just having this feeling in my heart and in my gut that, wait a second, that sounds an awful lot like what we were hearing in 2003. And we knew that China had come a long way in terms of understanding coronaviruses and understanding and being more open about transmission and things that were happening. We also know people in China are very connected to the internet in many different ways. So we were hearing stories over Christmas, and then early in January, we started to hear more stories, and that worried me and my colleagues at the BC Centre for Disease Control. We watch these things very carefully. We have an ongoing surveillance system for respiratory illnesses, and of course at that time we were in the middle of our influenza season. So we were starting to see people getting sick with influenza, but knowing what was happening in China, and it became really apparent around the Lunar New Year that there was a lot of movement and a lot of people were getting sick. And then it became very apparent to us here that, knowing the patterns of travel that we had globally, but also here in British Columbia and across Canada, that it was very likely we were going to get some cases. Now, remember, at that point in time, we still were at the point of thinking that, yeah, we can contain it. And we were watching very carefully what was going on in China. So our public health system in BC mobilized very quickly. So our team at the BC Centre for Disease Control and those public health people that work all of our health authorities around the province. So those are my colleagues and my team, the team that we work together. So that are medical health officers and public health nurses, environmental health officers. They're people that go out and work in our communities to keep us safe from disease. We provide immunizations, we do inspections of restaurants, we food premises. Anyway, we got ourselves together and across the country. I was talking regularly with my counterparts in other provinces about making sure we could develop a test. And that's one thing we did in BC very, very quickly. Our BC Centre for Disease Control Public Health Lab, Dr. Mel Christian and his team, within a week of the genetic sequence being put online for China, we had a test here in British Columbia. And then we focused on finding anybody who was coming into BC who might be bringing this virus with them. And of course, we were watching very carefully what was happening in China, and we could see that it was spreading. We could see the enormity of the response in Wuhan. And I'm sure everybody here, but certainly for me, it was like, oh dear, this crackdown, this lockdown, we'd never possibly do those things in our country. Are they going to be effective? Is it going to work? Is it going to be able to get this virus back into nature, which is what we were able to do with the SARS outbreak in 2003. So at that point, you may have heard me starting to talk about that we needed to detect and contain and prepare because we didn't know what was going to happen. Part of my whole story as well is I've worked for many years with the WHO and others around pandemic influenza planning, and I've been the chair of the Canadian Pandemic Influenza Planning Committee. We've got a whole plan for the country, and each province has their pieces of it as well. So we very quickly dusted off that plan because even though it was influenza, many of the things would be very similar. And part of my role internationally has been working on what we call public health measures or non-pharmaceutical interventions. That's the sort of WHO word for them. And I had actually been at a big meeting to talk about all of the evidence behind things like school closures and business closures and how they work and mass gatherings and how they can prevent transmission, all thinking about influenza because we knew another influenza pandemic was probably inevitable. Anyway, so we've dusted all those things off in our thinking as well. And through January and February, as you're aware, we had a number of people who imported the disease into British Columbia, and our public health teams were able to find those people very quickly to manage all of the contacts and break those chains of transmission. And we were holding our own for a while, but as we could see, the virus was not being contained in China, and the myth and patterns of movement around the world, we started to see things popping up in other countries. Here in BC, because of the way we were preparing and the way that we were coming together, and the lab testing that we had, we actually detected people may remember my calling it a sentinel event, where we had a woman who had returned from travel to Iran, and the clinician who saw her, we thought that she probably had influenza, but she talked about how on these multiple flights that she was on and in Iran itself were people who were ill. And so on a hunch, they took a swab and it was tested for COVID as well and turned out positive. And it was the first indication in the world that there's an issue going on in Iran. And as we know, that very quickly spread in that country, and awareness that this virus was now spreading in many other places became much more acute for all of us. We here in BC, and really I think it's because of the experience that some of my team brought, and we met with the Minister of Health here and the rest of government, as well as the team at the ministry. So in particular, the Deputy Minister, Stephen Brown, and we had many conversations about here's the things that can happen based on my experience, on what we know the possibilities are. And we got the provincial system together. And I think we were talking a little bit earlier, Joyce, about, how did that help us prepare? The fact that we just recognize early on we needed to have a coherent provincial response, which means all of our health authorities started their emergency operations centers. They started thinking about what protective equipment do we need. We have in different places around the province. Let's make sure that we get it all together so that we can make sure we have enough for everybody who needs it. We included our long-term facilities as part of our plan because we recognize that the supply chains for PPE were becoming interrupted because a lot of it was manufactured in China at that time. So, these were the things that we're thinking about. I had the occasion to talk a number of times to Premier about what we needed to do as a province to try and respond. And at that period of time, we were starting to see what was happening in Italy. And I think for many of us, the crises that it became in northern Italy in particular was really a sentinel event in a different way that reminded us that we needed to prepare and we needed to not get into that situation. And that was the heart of everything we're doing, because we knew that we needed to be able to safely look after people who had this disease. But if our healthcare system got overwhelmed, it would overwhelm our ability to provide care for people with everything in our system. And you can't have economic growth and societal growth without health. And so it was not either or. It needed to be doing whatever we needed to do to protect both. And in that case, we started to see increasing number of cases here in BC. And really around March 13th, 14th, just coming onto Arch break, that's when we had to make some very critical decisions. And watched what was happening, talking to my colleagues in Quebec, knowing that they were starting to see increased numbers of cases of people who had gone away for their March break, which earlier, particularly people coming back from France and coming back from places in the US. And then I also have regular connections with my contacts in Washington State, in Oregon, and Alaska. And it became really apparent that the US was struggling with their testing. They had some challenges developing their test, and Washington State had a lot more transmission than they realized. And all of those things came together within about 24, 48 hours. And I made some recommendations to the Minister of Health and the Premier, and because we had been prepared and we had been thinking about what were the actions that we might need to take. And so that's when we started putting on the restrictions here in BC. We suspended incomes from teaching. We put on the requirements that anybody coming into BC from outside the country needed to quarantine for a period of time. We also had to redirect our testing because we had limited capacity for testing at the time in the lab, but the supplies that we did, even the swabs were in short supply. And we need to focus on those people that were going to end up in hospital and healthcare workers to try and prevent that transmission and the whelming of the hospital system. So it seems like a decade ago now, but that was the middle of March. And since that time, that has been our focus, has been on managing our cases. And the things that we do that were hard, sacrifices that all of us made across the province to keep ourselves to ourselves, to reduce those contacts we had in the community. And we look at the numbers of people who were, because we know that once somebody is exposed to this virus, we have nothing that will prevent them from becoming ill. And to prevent explosive outbreaks of this infection, what we need to do is sick people away from well people, and those who are in the incubation period, we need to support them to stay away from others, isolate until they're through that period. Or if they do get sick during the period, to make sure that we can support them in case they need hospital care. So that has been what we've been doing. And then in the middle of April, we reached that point where we stopped having large numbers of people in the community that were popping up that weren't linked. We're now at a place where we are still having outbreaks. We're still having community outbreaks. We're still having outbreaks in our long-term care homes. I often say we each have our own pandemic, and particularly in BC, our pandemic is slightly different from other parts of the country. And ours was early on in a long-term care home, and then we put in some very extreme measures in those care homes that have made it so that we have not seen some of the tragedies that we've seen in other parts of the country. But all of this has been very, very challenging. The basic messages about the physical distancing, the safe physical distancing, but staying connected to each other in the community. Those are the things that we can focusing on, and that people in BC, every day we see the generosity and the care and the compassion that we are showing for our neighbors. And our philosophy in going through the crises, and reason I talk about some of the things that I've been through before is because I do absolutely believe that we need, when something goes on for a long period of time, and foreshadowing or understanding that it could go on for a long period of time, we need to come from a place of togetherness and support and compassion and kindness, because that is what helps us as a community, as a people, get through these most anxiety-provoking and fearsome events. And so that's been our approach here. I think it has helped us a lot.
You've already started to answer a number of the questions that have come in, so that's great.
Okay.
I'm wondering.
I'm going to finish up in like 30 seconds. So I was just going to say, one of the things that I worry about a lot is the unintended negative and positive consequences of the measures that we have in place. And the question that we asked this week was, how has it affected you? But it didn't say, was it positive or negative? And we are getting a lot of feedback that there have been positive things. But we are watching as well for the unintended negative consequences. And our philosophy going forward will be, how do we titrate the measures that we need to put in place to keep this virus suppressed so that we're not seeing explosive outbreaks, but minimize those negative consequences. And if we can, enhance the positive things that have come out of this. And so I'll leave it like that.
Thank you. So I think a lot of what we've been getting in terms of the questions people are asking, well, there's a number of themes. So one of the themes that's come forward is around, well, we understand where we are now, and we know that things will calm down likely over the summer, but what happens to trigger a second wave in the fall? And I'm wondering, Jocelyn Johnston, I'm wondering if you might be willing to ask the question that you submitted. And to do so, I'm gonna see if we can find you in the list. I had you there, and then the list moved. And then to unmute yourself, we'll have to. Where did you go? I don't see you in my list anymore. All right. Oh, I see. There you are. Okay, Jocelyn, you are unmuted. Would you be willing to ask your question of Dr. Bonnie Henry?
Yes, I would. Thank you. And I guess I should be honest. I'm also the executive director for the BC Dental Association.
Yeah.
And this is a question that my members, and actually everyone is, but in particular, I think anyone who is in healthcare really wants to know this question because, as you can imagine, it was quite traumatic, closing dental practices, managing patients over the phone. We don't want to go through that again. So what can we do?
I should have done my time check before I got started on Q&A. So I'll just do that right now. It's just to say, so we've got about a little less than 20 minutes together. I'm asking everyone to have their question really be as focused and brief as they can. And then Dr. Henry or Minister Murray, as you respond, to also do the same. Okay, back over to you, Jocelyn.
No, that's fine. I think that really is the basic question. I think we all want to make sure that there's not a second wave in October or one in March, which is another concern. So,
yeah, and there's a couple of, we don't want a resurgence right now, and that's why the restart is going slow and low numbers, and why we're focusing on the messages about how we do that safely in a slow, measured way. My concern, and I've been quoted as saying it's inevitable, but we've never had a pandemic where there hasn't been a second wave. And the concern is, as we go into fall, we know we're going to see influenza again. Are we going to see an increase in COVID? Because we know that other COVID viruses that cause much milder illnesses often start to appear again in the fall. Usually for us in BC, that starts in November, December. And we often get a peak of our influenza season in January and February. So will we see it? Will we see it earlier? Will we see it at the normal time we see influenza? Those are questions we can't answer at this point. But I'm hopeful that over the coming weeks and months, we'll learn more about this virus. We'll learn about what immunity means, all of those things. So the short answer is, can we do? We need to keep doing things that we're doing now, which is screening people to not come into our dental offices, not come into work, not come into any place outside of our home, stay home if we're ill. And that is going to be the number one thing we can do to protect ourselves. Plus, maintaining our safe distances, because we know this is a droplet spread virus, which means we get it from each other, from being in close contact, being within that safe space. And that's how the germs are spread. Primarily, we're close together for a period of time inside. So focusing on making sure that we're not allowing sick people into our environment in a dental office or a massage therapy or a physician's, well, physicians, we see sick people all the time. Making sure we have a process for doing that and that's safe for everybody.
Thank you. And in the more immediate term related, a number of questions are coming in around the summertime. There was a question here around travel this summer, Blair. And would you be willing to please unmute yourself? And I'm going to just, oh, there we go. And I'm going to unmute you, Blair, or you can choose to unmute yourself if that option comes up in front of you. Please share your question about the summer's travel.
Hi, can you hear me?
You can.
Yes.
Yeah, thank you very much, Dr. Bonnie Henry. We're avid kayakers and bikers, and we'd like to travel away from our home to other places like Tofino and go kayaking or walk in forests, and also maybe do a bike trip on the Galloping Goose. But we realize we have to travel away from Vancouver City to Vancouver Island, but we would do it with physical distancing. But would you advise to doing something like that and staying in an Airbnb and stuff like that?
Thank you very much, Blair.
Yeah, and I think absolutely. I think we need to look at how we can support those communities that are incredibly dependent on tourism, but BC focus. You know, I don't control a lot of things, obviously, around the world, and we know that international travel is going to be a challenge for a long time. There's just not the flights anymore. Other countries are still going through this and still at their peak, even across Canada, we haven't reached that point yet. We know that we're continuing to have concerns about our neighbor to the south for a variety of reasons. So I do see it come July and August, we should be able to do that. We are still within the first incubation period, just starting the second incubation period of our restart. And, you know, and there's a lot more things are starting to open. So for the next weeks, we still need to be very cautious. But I absolutely am supportive, and I'm hoping myself to be able to go somewhere and have a little bit of a vacation. But we should be planning for July. And we need to support those communities. And I do think it's also very important that we don't go to communities where there's still concern. And if we do go, that we to other communities, that we bring our supplies with us so that we're not overwhelmed the local grocery store or the local, you know, make sure that we're being considerate that way. And communities that have concerns, and we've heard it earlier, particularly our First Nations communities, where they have been differentially affected by pandemics in the past and by whole many other things, and the protection of elders and the keepers of knowledge and culture in those communities is so important. So I would say, yes, we absolutely should be traveling in BC this summer, but only go to those communities where you're invited.
Thank you so much. Kristen Severson, I'd like to unmute you, and I'd like to have you submitted a question about thinking backwards. And so if you'd be willing, and we'd love to hear your question that you submitted in advance through the email. And where did you go? there's a lot of, there you are. There's a few of us managing it together. Kristen, you are unmuted.
Yeah, are you referring to the question I just submitted?
I didn't
About
see
the mask? Oh.
No, the one you submitted in advance in hindsight.
Oh, if there was, looking back, if there was anything that you would do differently?
Yeah, really good question.
Probably
And
a
I was
question.
absolutely aware of this at the time we were making those decisions. And the ethical dilemma we're in is to do enough, to get to just enough, and try not to put in too many restrictions, but enough that it would work. And of course, at that time, we didn't know what enough was. So also very consciously made the decision that it was better for us as better for the health system, but better for us as a community, as a society, to err on the side of doing too much, because if our healthcare system got overwhelmed and we were in a situation like we were watching in Northern Italy and then in places like New York City, you can't go back from that. You can't give people lives back, but you can give people economic support. So we did err on the side of doing more, although I will say here in BC, there's a lot of things that we didn't shut down, but that naturally closed because of the concerns and the risks. And because of the messages we're getting and what we're seeing from the other parts of the country. Now we're starting to increase again. We know more now, and we know what are the things that are most important. And that's what we'll be focusing on come the next few weeks and then to the fall.
When you say we know what's most important, that means monitoring people for symptoms and keeping a distance. And
yeah, so we know that the distance is important. We know that that we can safely reopen things like shops and retail stores with these precautions in place. And we'll say again, these are not forever, but they are things that we need to do for this period of time, possibly for a year to 2 years. So we need to get ourselves comfortable in being able to do certain things, being able to get our economy going, to go to school, to be able to manage occasional cases of this virus. And that's what we're focusing on in the health system, making sure we have the capacity in our hospitals and making sure we're to look after people with COVID and everybody else who needs it as well, without shutting down surgeries the way we did before. So those are all the things that we're balancing now. And as we learn more in the coming months, we'll be doing that better, hopefully.
thank you for that. My next question is, I have a couple questions for Minister Murray. The first one, Gail Sparrow, would you be willing to unmute yourself and ask your question about capacity of Indigenous communities? Let's see. Hopefully.
No, it was done.
So you do have talking permitted, but I'll press the unmute button on my side, but you may need to press unmute on yours. I'll give you 1 more minute to try it and then maybe we'll come in. Okay, while you're working on that, Gail, feel free to unmute and pause while we're waiting. A question did come in previously from Dr. Chris Finch, Minister Murray. What are the federal government's priorities for Canada's recovery plan after COVID-19 or in response to what's been happening as well?
Well, I want to just thank Dr. Henry for your remarks. I haven't had a chance to do that yet, and for the work that you've been doing. And I love the fact that we're able to be talking about what is after. And I think that there's a very common theme amongst the members of Parliament or ministers that I've chatted with, and that is how can we use the crisis as an opportunity to improve things. And so you've seen some of those with respect to how can we advance our intention to transition to a clean economy justly over the future. How I think with what we've learned from the digital responses, that we've had such fast responses in the public service to things that normally would have taken much, much longer. There's an opportunity to figure out how we can accelerate our improvement of service to the public using digital. So I think that's the key, is that it's early days in thinking about this, that we want to use this to do a better job on social justice, on public health preparedness nationally, and on green economy, on serving people and those kinds of things. And we're just starting to develop those conversations and plans.
Thank you, Minister Murray. And so unfortunately, Gail has not been able, oh, there you are.
There I
Gail,
am. Got me?
do you want to ask your question about support for Indigenous communities?
Joyce, I don't know if you're aware of this, but we know in our communities that Trudeau has provided, it's now the budget's up to $1 billion for the First Nations communities, and it states in it it's going to the communities directly, but we don't have emergency personnel to manage pandemic on our reserves, and there's no funding for that. And so how do we manage the community members when we don't have people that are qualified or trained to carry that out? Presently, to date, we're on the seat of our pants. We've got our chief and council running it, and unfortunately, that it's not serving our need. And our concern is my dogs are here. Sorry, we have a greater need here in Musqueam because our people are at a higher rate of suffering the circumstances from the pandemic, economic basis especially, and we're not getting the return and the help that we need from a team of experts, and we can't get the answer from the federal government who's allocating these funds.
Well, thanks for the question, Gail. And there's a number of supports where the government is providing funds, but the provincial government delivers. And I know that can sometimes lead to delays. The key underlying principle that our Prime Minister has expressed to us and publicly is that the biggest focus of our support and our concern must be for those that need it the most, those that are the most vulnerable, and that includes Indigenous communities. So I wonder if Dr. Henry has some thoughts about this. Also, the Indigenous Health Authority in British Columbia, because the actual delivery is something that we're very respectful of provincial jurisdiction and territorial jurisdiction. But the bottom line is that the Prime Minister is really focused on Indigenous peoples and communities in the allocation of resources.
I'm afraid I don't know exactly how it's working. I do know the First Nations Health Authority has been coordinating and working with nations across BC around some of this. I also know that there's been allocation to the the Aboriginal Friendship Centers as well. That's really important, but I'm not privy to the detail of how that's been going.
Thank you. As we move towards the end, I think I'm looking at the questions that are coming in. Thank you all for these questions. They are just marvelous. There was probably one last theme here is about how to navigate the change from we are isolating, staying at home, to being back in the community. And let me just see if there's someone who asked the question in a way that's representative. I think just as maybe timing, I'll reflect it back, is this piece around, that some, people are, the attention to social distancing has diminished. People are now playing soccer, they're going out. We're wondering about, do we wear masks? Do we eat in restaurants? Do we take ferries? How many people do we add to our bubble? And just as some closing guidance, Dr. Henry, I think this community here wants to be responsible citizens as best they can, and would love your guidance about what that looks like at this moment, and then maybe looking forward to next month.
Yeah, these are the things that are going to challenge us, and there's no hard and fast rules, except that we always have to take into account our distancing, making sure that we wash our hands regularly, covering our mouth when we cough, staying away from others, absolutely no exceptions if we're feeling unwell. And right now, that means even the least bit unwell. So those are incredibly important, and they won't change. Yes, a non-medical mask can be helpful in those short-term situation. So not something you should be wearing all the time. We also need to recognize those short-term situations where you may not be able to maintain your safe distance all the time. So maybe on transit for short periods of time, or if you're going into a smaller grocery store, for example, which is the thing that I did on the weekend and wore a mask. But those other things that we've put in place will protect us. And we have to recognize that that not everybody can wear even medical masks because of their own health conditions or disabilities. And you know that we can't always tell why somebody can't wear a mask. We need to continue what we've been doing here in British Columbia, which is being respectful of each other, being compassionate with each other, being kind to each other. And that's what will get us through this next period. In terms of opening up our social connections, what we need to find is that spot that allows us to have social connection that we need, and absolutely do need, without giving this virus an opportunity to spread widely between large numbers of people. So that's where we put in the 50-person limit for gatherings and events and church services and environments where we know it's risky because people come together, they spend time together in a close environment. And even though we try and maintain those physical distances, we have seen recently in New Brunswick, we've seen in Saskatoon, where this virus can be transmitted and we can get lots of people exposed. So that's what we don't want. And how many people will be in our bubble depends a little bit on our own circumstances. So if I'm somebody who's in my 80s and living at home, I may not want to expand my circle too much. If I am somebody who's going back to work and my children are going to school, I have to recognize that I'm having their contacts, the contacts of people in our school, that my social network has expanded. So I might be cautious about including a friend who's going through cancer treatments, making sure that I'm protecting them. So those are the considerations that all of us have to do based on our own circumstances. And that's what's going to get us through this next few months.
Thank you so much, Dr. Henry. And one last thing for me, and then I'll pass it back over to Minister Murray, is that probably another important theme that has come out here from the questions coming in for you is actually comments of support and gratitude. A number of people have asked, how can we support you? Someone said, I would like to nominate you for the Order of Canada. People letting you know that they are wearing their socks right now, but they have tons of flu-bug shoes at home. Overall, this community of people here joining you today just want to express their gratitude for all that you're doing and bringing to the situation. So please hear that from their voices through me. Over to you, Minister Murray.
Well, thank you. Thanks, Susanna. And I want to thank everyone for joining us at today's virtual event, an experiment, and I think it's gone very well. And thank you. So I want to thank my staff, Jonathan, Hannah, Miranda, and Tessica for making this happen, and Kaylee. And thank you, Susanna, again, for the moderating of this amazing number of people with so many questions and so much interest. I wish we could have answered them all, but we don't actually want to create too much more load for Dr. Henry, because Dr. Henry, I want you to be kind to yourself and take a break as soon as you safely can. So thanks for being our first MP Brunch Connections special guest. And I'm going to let everybody on this event know that Dr. Henry's book, Soap and Water and Common Sense, was first written in 2009 and has been republished. So you may be interested in buying one if you would like to know more about her backstory. So we have a small token for Dr. Henry. It was generously donated by a local Native business, which is Native Northwest. Thank you, Gabe. And it's an eco scarf made from 100% recycled materials. So thank you, Gabe, for this contribution. And Dr. Henry, we will be putting the scarf in the mail for you. So stay tuned for our next virtual MP Brunch Also, as I mentioned, Aphrodite's is opening again on Wednesday, and we look forward to getting back to them for our MP breakfasts, but not yet. So enjoy the rest of the week. And Dr. Henry, thank you for what you do. Please keep on carrying on.
Thank you. Thank you very much.
Thank you. Thank you all for joining us today. And if you would like to see a recording of this webinar, it will be posted, and you'll get the information either through Joyce's social media or other forms of communication. Thank you all for joining us, and Joyce's team will be in touch with you again soon about future opportunities.